Do you know someone who seems sad, lonely, or isolated and alone? Many people in our country, including children and adolescents, struggle with depression. Some of you listening may have already experienced depression or may run into it in the future. Many people in my family have struggled with depression on a daily basis. Depression is a mental disorder that affects many lives that surround us, whether or not we are aware of it. Learning about it may better another person's life in the future. Today, I'm going to inform you on the basic facts about depression, how they diagnose it, and some ways of treating it. According to the American Psychological Association, depression is in fact the most common mental disorder. Many people look at depression as just people that are sad or upset all the time, when really there is much more to it than that. As stated in the Webster Dictionary, depression is a state of feeling sad or a disorder marked especially by sadness, inactivity, difficulty in thinking and concentration, a significant increase or decrease in appetite, time spent sleeping, feelings of rejection and hopelessness, and sometimes suicidal tendencies. According to the American Family Physician, at any given time, up to 15% of children and adolescents will experience some symptoms of depression. Once kids have reached the age of 14, depression is twice as common in girls over boys. If you or anyone you know have had these symptoms, you should be considering testing for a depressive disorder as well as other mood disorders. From a study taken in 2007, more than 70% of children and adolescents with depressive disorders or other serious mood disorders do not receive appropriate treatment or diagnosis. Over the years, has always been a stigma about mental disorders. People often look at people who suffer from them or depression as crazy, and young people who are already at a critical point in their lives socially do not want to be recognized as someone with a serious mental or mood disorder. To diagnose someone with a depressive disorder, many factors come into play. One of the first steps is to rule out any other possible causes like various medical causes and diseases, as well as side effects from medications. Some other key factors include whether the symptoms are drug or alcohol related or induced by a stressful event from life. All of these are ruled out. They question the person that is being diagnosed about certain things. After a young person is then diagnosed with a depressive mood disorder, they are generally sent to meet with a psychologist or psychiatrist for further treatment. The options for treating a depressive disorder tend to vary depending on the child as well as the situation. Some of the medication usually treats most depressive disorders. From the Mayo website, learn about different common types of medication. Some of these are serotonin reuptake inhibitors, SSRIs for short, serotonin and norepinephrine reuptake inhibitors, SSNIs for short, atypical antidepressants, tricycle and tetracycle antidepressants. Some common examples of these that are heard every day are Celexa, Lexapro, Prozac, and Cymbalta. Medicating is usually the most common treatment preferred by people with depression, but the risks that come along with it need to be taken into consideration. While these young people are prescribed these medications, they are carefully monitored to watch for possible side effects, which include dizziness, dry mouth, upset stomach, sleep problems, change in weight and appetite, and suicidal thoughts or tendencies. While talking with my sister, she ended up trying a few different medications because the side effects really bothered her on the first few medications she had tried. Usually, therapy goes along with individuals using medication. According to the American Family Physician, cognitive behavior therapy is a treatment that is used to correct false self-beliefs that lead a person to negative moods and behaviors. Many studies have shown how successful cognitive behavior therapy is in treating depression. As you have learned, depression is a mental disorder that affects many people around us. I hope that learning about depression today can help you better identify it and understand it. I first informed you about what depression is. I then talked about diagnosing it, and finally how it is treated. I hope that all of you have learned something today and are able to use this knowledge in the future.